Hi everyone, and thanks so much for joining us. My name is Justin Smith. I'm a pediatrician here at Cook Children's. Today we're going to be talking about the human papillomavirus, otherwise known as HPV. We're talking about the vaccine that is being given to prevent HPV. Today I'm joined by my colleagues, Dr. Jason Turk, he's a Cook Children's pediatrician, and Dr. Jerry Barker Jr. from Baylor Scott & White Health. Dr. Barker specializes in adult radiation oncology. Thank you both for being here.
Thank you.
Thank you.
Before we get started, we know that this is a really hot topic and that people have really passionate opinions about it. You may see some of those comments reflected in the stream below. We want you to know that we're going to do our best today to address both the safety and the efficacy of the HPV vaccine. And so if you'll stick with us through the end, we'll try to address both. Dr. Turk, let's begin with you. Why should parents get their children vaccinated against HPV?
Well, this is an extremely common infection, and we know that about 80% of our kids are going to become infected at some point in their lives with this infection. And so this is not an insignificant problem. And what we also know about this infection is that a substantial number of those people that get infected are going to develop cancers later on in their lives, 10, 20, 30 years down the road. I have a nurse that used to work for me and that used to work for Dr. Smith, and she went from pediatrics to hospice care, and she reminded me of how important this vaccination is only last week. She texted me to let me know that she was taking care of a 28-year-old woman who was dying from cervical cancer, and she was leaving behind a couple of kids and a husband. And a few days after she texted me, that unfortunate woman died. That's what I want to prevent as a pediatrician. That's what we do in pediatrics. That's what we are all about, is preventing bad things from happening. And because this is such a common infection, because we know it can cause cancer, that's why this vaccination is so important for our kids to get.
And it's true that like a huge percentage of people will contract HPV in their lifetime. Do you know that around the rough numbers on that?
We know that about 80% of people are going to become infected with HPV at some point in their lives. And so it's a risk that you can avoid by virtue of your own good choices. And if you know that 80% of people are going to become infected, it's a reality that you have to assume is going to exist, and a risk that you have to assume that is going to exist for everybody.
Okay, Dr. Barker, so you treat patients who didn't have the opportunity to get vaccinated against HPV. So what kinds of problems do you see that could have been prevented from the vaccine?
Well, there are a number of problems that can be prevented by the vaccine, and the problems are serious. First, there are the cancers themselves that HPV can cause, and it's not just one cancer. Classically, we think of cervical cancer as the cancer that HPV can lead to, but it is a number of cancers that can be caused by HPV. A number of them are pelvic cancers, so anal cancer, penile cancer, vaginal and vulvar cancers would be examples. One of the biggest problems, and I'm sure we'll talk more about this, is the increasing number of throat cancers that are caused because of HPV infection. This is actually an epidemic of cancer that we're starting to see. So the cancers themselves are a problem. The cancers cause problems. So, you know, when I see a patient who is diagnosed with cancer, they may have bleeding, or they may have pain, or trouble breathing, or they may have trouble with their bathroom habits, or they may have, you know, a wound that smells, or some problems just cause. And then, of course, you know, we have to diagnose a problem when someone shows up with symptoms, and that involves a lot of testing, a lot of expense, a lot of time and energy from patients. So really, all of these problems can potentially be prevented with simple vaccination.
And I think one of the things that's particularly concerning or troubling about it is that often these affect people at a different stage of life than you think about cancer usually causing problems. And so, you know, for me, it's just different to think about a woman in her 20s or a young man in his 20s or 30s being affected with these cancers. But these cancers affect much younger individuals than some of our other cancers.
They do. A lot of the patients that we treat in oncology are in their 70s or 80s. But actually, one of the ways that we learned about HPV causing cancer is because we started to see so many young people developing cancer in the first place.
So, Dr. Turk, you know, I think a lot of our parents come to us asking about the HPV vaccine, or as we're counseling parents, and they have unique questions or concerns, maybe different than they have about the other vaccines that we might be offering, even on the same day. So I know you've reviewed the literature multiple times, you've written several articles for us about it. What risks do you discuss with your families that, are there any that you believe are unique to HPV?
Well, it is true that this vaccination, unlike many other vaccinations that we routinely give, has created quite a buzz, and there are a number of reasons for that. And so people have a heightened level of awareness and may have more questions about this particular vaccination than the other vaccinations that we routinely give. But really the only thing that we see with an increased frequency with this vaccination compared to the other routinely given vaccinations is the fact that it stings more when it goes in. And when we initially were giving this vaccination when it first came out just to girls, 11 and 12-year-old girls, which is a population that tends to have a higher frequency of swooning anyway, we found that the stinging of the vaccination may cause them to feel faint. And so we had some people faint because of the pain of the vaccination. Once the boys started getting it, it was no surprise that they started fainting a little bit too. So now we mitigate that, or we avoid that, by just having people sit for 15 minutes after the vaccination, and nobody faints. Other than that, there are no special risks with this vaccination. It is made with the same kind of technology and works exactly the same way as other routinely given vaccinations. It is highly effective, and it is extremely safe. It's also been around now almost 12 years.
And it's been around 12 years, so it's even not the newest vaccine that we recommend. But parents do ask about that. Well, how do I know it's truly safe? It's not been around a long time. How do we know it's even effective? I've heard the discussion about, well, it may prevent disease, but does it truly prevent cancer? Or what evidence do we have surrounding that at this point?
It's going to be a while before we really know how well the HPV vaccination works to protect against cancer. But we do have some early indications of how effective this is. The earliest indications are that girls who initially started getting the HPV vaccination are not really getting those types of viruses isolated from their swabs when they get swabbed for well woman exams. And so there's been a dramatic decrease in that. There's also been a dramatic decrease in the frequency of HPV-associated genital warts, particularly in Australia, where this vaccination was more rapidly adopted and was more early adopted than here in the United States. The frequency of genital warts has dropped dramatically in both boys and girls, and initially it was just recommended for girls. So it'll be some time before we can really say how well this vaccination does decrease the frequency of cancers associated with HPV, because that's just the nature of how long it takes for these cancers to develop. But otherwise, this is an extremely safe vaccination. It's highly effective at protecting against infection with those types that are in the vaccination, which cover the majority of types that can cause cancer.
And parents, I think, sometimes ask, well, why are we offering this vaccine to girls who are 11 or 12, or children, boys and girls who are 11 and 12? What should they know about why that recommendation is placed where it is? Sure.
Well, it's one of the things about vaccinations that we want to give the vaccination before there's any consideration of risk. If you give any vaccination around the time that you think that, oh my gosh, this person might be getting this infection right now, then it's usually too late to provide that protection. And so for any vaccination we want to give, whether it's the flu vaccination or the HPV vaccination or a vaccination to protect against other important infectious diseases, we give the vaccination before there's consideration of risk. And so 11 and 12-year-olds are the ideal population. We also know that younger teens respond better to the vaccination than older teens. And that's why younger teens who start the series before their 15th birthday only need to get 2 of those injections instead of 3. And so we see a much better response for the younger population to this vaccination.
And Dr. Barker, you mentioned earlier that you treat a lot of head and neck cancer, as we were talking before. Tell me about what you're seeing in terms of the rates of head and neck cancer, and what's changing about the nature of HPV-related cancers since we've started the vaccination program.
It's an interesting story. When I was in training, we all knew that HPV was associated with cervical cancer. But for many, many years in oncology, we really deeply believed that the only way you could get a head and neck cancer was by smoking heavily or having very heavy alcohol exposure. Unfortunately, that belief broke down in the late 1980s and 1990s when we started to see too many people and too many young people being diagnosed with tonsil cancer, base of tongue cancer, these throat cancers. And it was at that point that we realized and recognized that we could see the virus inside the cancer. So it became obvious there was an epidemic of viral infection that was driving an epidemic of cancer. So in the late 80s and 90s, we recognized that was happening, but unfortunately it hasn't stopped happening. So we can look back over the last 30 years of cancer patients that we treat, and we can see the rates have been increasing about 5% per year. And I can remember when I started my practice about 15 years ago, I would see maybe one patient with an HPV-related head and neck cancer, throat cancer, every couple of weeks. Now it's not uncommon for me to see 3 to 5 patients a day right here in this community. And that's not just my experience, we're seeing that worldwide. So the rates have really significantly increased.
So I would say that there are some doctors that you don't mind seeing, your pediatrician hopefully, your family practice doctor, the dentist, but there are other doctors that you never want to have to go see. And although Dr. Barker's a nice guy, I don't want to ever have to go see him as a patient. I don't want any of my patients to ever have to go see him eventually, and I don't think any of our parents want to have their children eventually become patients of yours. And that's what this is all about, is preventing these outcomes.
Definitely. And I think another thing that we often get a question about is, well, why does my boy need protection for HPV? So tell us a little bit about sort of the risk of HPV-related infection in men as any different than females.
There is a difference. Obviously, men do not have cervical cancer, but they can be diagnosed with other kinds of HPV-related cancers, whether that's anal cancer, penile cancer, or these throat cancers. It's interesting that when we study the epidemiology, when we look at who is infected with virus and who gets a throat cancer, we find that there are 4 times as many men diagnosed with these throat cancers than there are women diagnosed with throat cancer. So there's something fundamentally different about how the virus is affecting men and women when it comes to head and neck cancer. But there's more than that. So very recent data have suggested that men may play a very unique role in how the virus is being spread through communities. It may actually be simpler and easier for men to become infected in some cases. And it may be easier for men to pass the virus than it is for women to pass the virus. So I think you take all of these pieces of information and it becomes pretty clear that the sort of old-fashioned thinking that this is a problem for women is not accurate. And in fact, it may be at least as important, maybe even more important, for boys to be vaccinated as it is for girls to be vaccinated.
I think that brings up an important point. That's one of the questions that I get. Well, I know my son, I know my daughter, that they're not at risk. And I would say, like, one of the things that's important is to know that it's not just sexual intercourse that transmits the disease. It may be much simpler to be past that. It may be that even other intimate contact, even other things that you may not think as threatening or as risky as intercourse may be sources of transmission. And I think that's just something important for parents to keep in mind. In addition to that, I think, yes, you may know your son or daughter, and yes, they may wait. But that doesn't mean that their future spouse will, and that doesn't mean that they're not going to be at risk. And I would think that even if that was sort of your inclination, was to believe that your child will wait, and they do, most people who have that inclination wouldn't believe that they should eliminate every potential partner of their child from being a future spouse because of their past history. They would probably believe in forgiveness just as much as they would believe in having their child abstain from sex. And so I think it's an important reminder that that's not necessarily 100%. That even if your child does follow the path that you've wanted to lay out for them, that doesn't mean that they're going to be protected.
I've actually said to some of my friends, it's not my daughter that I'm worried about, it's your son that I'm worried about. And I think you're right about that.
And I think a good analogy is to say, well, my son or daughter might also be a reckless driver, but I'm not going to tell them not to wear a seatbelt. Right. And I'm going to have them put the seatbelt on.
I think that if 80% of our kids are likely to become infected with HPV, the mode of transmission is not that relevant, okay? But if people ask me in the course of seeing my patients, if people ask me, well, isn't this a sexually transmitted infection? I say, well, yes, this is a sexually transmitted infection, but it's a mistake to think about this in the same class of STIs as syphilis and gonorrhea and genital herpes, which in the baseball analogy of sex, you pretty much have to hit a triple or home run to get. First, second, and third bases are covered with HPV. It's much more easy to transmit, and you can't avoid it by virtue of your own good choices. And the other thing to think about that you don't ever want to think about is that many of our children will not be willing participants in some of their sexual experiences. And we just have to do the right thing as parents and protect them from those things we can protect them from.
Well, and if I could add also, most patients who are infected with HPV have no idea that they've ever been infected.
Can't
There's
screen
no
for it.
symptoms.
You can't screen
for it. That's right.
Well, I tell you what, guys, I know this is, again, a really passionate a really passionate topic for some people out there, and I appreciate you guys coming on and sharing the science that you know. I know you guys are well-versed in the science. And I would say that having done the research myself, having listened to experts like you guys, it's good to have the confidence of science to know that this is a safe and effective vaccine. And I think one of the most common questions I get is, what do you believe about the science? But really, is what would you do for your kid? And I can say that with confidence that both my boys and my daughter will be vaccinated for HPV, and I hope that you guys will consider the same.